Hi, everybody. Thanks for dialing in to this webinar, jointly presented by NASEO's Transportation Committee and Rural Energy Task Force. We'll hold on a couple more minutes and then we'll get started. Hello, everybody. Thanks for dialing into this webinar on supporting rural transportation options. We're right at the hour. We'll just wait another minute for people to log on and then we'll get started. Hi, everybody. Well, thank you for dialing into this webinar, jointly presented by NASEO's Transportation Committee and NASEO's Rural Energy Task Force. Before we dive in, just want to go through a couple logistics. All the participants are muted, but we will have time for Q&A at the end. If you do have questions, there's a couple ways you can ask them. There's a questions tab on your GoToWebinar panel where you can send questions to me and I'll ask them. Also, during the Q&A, there's a hand raising feature. You can raise your hand and indicate you have a question, and then I will unmute you and you can ask the question. And if neither of those ways are working, you can also feel free to email me at dtucker@naseo.org. So with that out of the way, let's turn to the topic at hand, which is rural transportation. We've seen state energy offices around the country continue to be leaders in advancing alternative fuel adoption and other innovations in the transportation sector to make it more energy efficient. However, the issues faced by rural communities are particularly challenging as they need to often travel farther distances and there really isn't the density to support public transit options in many cases. And we've seen this lead to a greater reliance on personal vehicles, with the average rural family driving on average 7,000 more miles each year than the average urban family and buying about 330 additional gallons of gasoline every year, which contributes a lot to higher spending on energy for rural communities. A 2018 study by the American Council for Energy Efficient Economy found that the average American spent 3.3% of their income on energy, while the average low-income rural resident spent about triple that, 9% of their income on energy. So we've seen a lot of states really trying to address this disparity and look for ways to provide new energy efficient transportation services. So we have a couple great speakers lined up today that are going to talk about options for supporting programs and infrastructure development to increase the options for transportation in rural areas. So I'll give a quick introduction of them and then I'll pass it over to them to present. So first we have Mark Brady, who is a program manager with the Nevada Governor's Office of Energy. Mark has led the development of the Nevada Electric Highway and is also a co-chair of the Rev West Group, which is a collaboration between 8 states to enhance electric charging throughout the main driving corridors of the Intermountain West. Then our first presenter will be Dr. Alana Knudsen. Alana is a program director in the Public Health Department at NORC at the University of Chicago, and she's a co-director of NORC's Walsh Center for Rural Health Analysis. Dr. Knudsen has over 25 years of experience implementing and directing public health programs and also leading policy research and program evaluations for effectiveness. And her team produced a rural transportation toolkit in 2018 that has a lot of great resources that states can leverage. And then our second presenter will be Diane Heiss, who's the Senior Vice President of Innovation and Business Development for the North Carolina Electric Cooperatives. She works with the member cooperatives as well as their statewide team to identify and incorporate beneficial electrification opportunities into the areas like electric transportation, as well as industry, agriculture, and grid flexibility. And previous to Diane's experience with the North Carolina Electric Cooperatives, she worked with wholesale power supply, resource planning, portfolio management, risk management, transmission planning, and regulatory affairs. So I think we have some great speakers lined up to educate us on this issue. So with that said, I'll pass things over to Mark to get us started.
Great, thank you, Dylan. Hello, everybody. So my name is Mark Brady, as Dylan said. I'm a program manager at the Nevada Governor's Office of Energy. It's the fancy name for the State Energy Office in Nevada. So in Nevada, we have a really cool project going on, but of course I'm biased because I'm working on it. It's called the Nevada Electric Highway, like Dylan mentioned. This is where our state, like many others out there, are using the VW settlement funds to install EV charging equipment across the state. And like many other states, we're choosing to do it to enhance our corridors to allow EVs to kind of roam the state and connect communities. That's really what it's all about. I understand this group is not just specifically about electrification, but more kind of alternative fuels and rural focus. But kind of what I do is electrification at our energy office. So that's kind of what I'm going to share. Just a quick story here before we kick it off to the presenters, which we have lined up. So kind of my view of the world is, as a government employee, kind of our role is to enable access for all types of vehicles between communities, because right now all the gasoline vehicles can travel back and forth, but somebody, say in a rural community, because they're more efficient, can save money in the long terms, but they need public charging. They need access to public charging to be actually able to drive back and forth because it's such long distances. So the government, in my view, is to provide kind of this bare bones infrastructure to enable people to be able to do that. So hopefully the private sector can see a business case and come in and start investing in it, but they're not going to do it. So it's kind of the chicken and the egg argument. Which do you do first? And that's kind of where I'm thinking that the government agencies, and not everybody views it this way, but the government agencies, with the help of VW funds, by and large, are starting to invest infrastructure in this sector. And this is really starting to kick things off, and we see a lot of EV growth taken off. This is very, very hard to do in some states, especially in the rural areas, because of the vast remoteness. There's no infrastructure for miles and miles and miles. And sometimes there's even no electricity grid infrastructure. So this becomes extremely challenging. So not everything is doable, but what we have found in Nevada is that kind of the big key to success and the major takeaway here is partner with the local utilities that service your state. If you have investor-owned utilities or co-ops, work with them. They have proven the key to success in Nevada to getting charging infrastructure up and running. So that's kind of the initial comments that I have here to kind of kick things off. And then we have two speakers. So first off, we're going to have Dr. Knudsen kick it off with her presentation. And again, as Dylan said, if anybody has questions, go ahead and type them in as we go. We'll answer them at the end, and we'll have some pretty robust Q&A at the end, hopefully. If not, you guys are going to hear me more rambling. So with that, Dr. Knudsen, go ahead and take it away.
Great. Thank you so much. This is a wonderful opportunity to meet all of you and to share some of our work. So I greatly appreciate this time with you today. As my introduction indicated, I am from NRCS at the University of Chicago. And for those of you who may not be familiar with our organization, we are a nonprofit, nonpartisan research organization, and we have historically conducted large national surveys, such as the National Immunization Survey and the Medicare Beneficiary Survey. But we also do a lot of work in the evaluation and research space for not only federal agencies, but we're also doing a lot of work for foundations. There's a lot of interest in looking at evaluation of programs, particularly as we think about developing business case for being able to sustain programs over time. I co-direct the Wells Center for Rural Health Analysis, which is the only rural health research center located in the Beltway. I work out of our Bethesda, Maryland office, and we are nearing 25 years of conducting our rural health research work. And if you ever have any questions or would like any information about rural health, public health, healthcare, behavioral health, our team is looking at all of those issues that really affect the health and well-being of rural residents in our country. I'm here to share with you some background information on work that we have done on behalf of the Federal Office of Rural Health Policy, which is located in the Health Resources and Services Administration. When we first started looking at some of the evaluation and some of the programs that were in rural communities, it was hard pressed for us to really find programs that had that gold star of evidence, those evidence-based practices and programs that have been implemented in multiple settings and that have had multiple positive evaluations, also published in many peer-reviewed journals. And we just don't have that kind of investment in rural America. So we have now been developing these toolkits that are topical based and that really reflect where evidence is at that gold standard. We share that, but we're also looking at those effective and those promising programs that really demonstrate a positive difference in rural communities. One of the issues that our Federal Office of Rural Health Policy colleagues was interested in addressing was looking at trying to help communities from reinventing the wheel every time a program was either developed or implemented. So we really are looking at not plugging and playing an urban program to fit rural needs, but really identifying those programs that work well in rural America. And all of these programs that I will be sharing with you and these resources are housed on the Rural Health Information Hub. And if you haven't been to that website yet, I think it's a very useful place for you to find current and targeted information. And this website is also supported by the Federal Office of Rural Health Policy. To give you some ideas about what these evidence-based toolkits include, we identify a topic such as transportation, and we do a broad search to find out what are people doing. And I have to be forthcoming. I'm originally from rural North Dakota. This is a picture from Carrington, North Dakota. I grew up in a county that had 3 people per square mile. The discussions that Mark just shared about lack of infrastructure and going miles and miles, there were more cattle in my county than people. I certainly understand this from a personal as well as a professional perspective. We look at some of these programs also through the lens of what are the facilitators for success, because we know that just having a champion in a rural community may not be able to sustain these programs over time. And so what facilitates success, as well as what are considerations for implementation, because there are also barriers. And then our last issue is trying to provide a venue to disseminate some of these lessons learned. And the way that we have constructed these toolkits, we have used a modular format. And so wherever a community or a group is as they are looking at moving forward, we want to meet organizations and communities where they are. So if they're just interested in getting some background as they're exploring an issue, they can look at our first module, which is a topic area. If they want to find out more about how this particular issue was addressed through different program models, they can go to that module on different types of programs. But we also, as I mentioned, include information about implementation considerations and sustainability strategies. And I'll explain a little bit more about that when I get into some of the details on our transportation toolkit. We also include a perspective on evaluation, because one of the things we have learned over time is that it's not just important to get that seed money to start a program. Many communities become very reliant upon those programs, so we need to figure out means to use that evaluation data to look at how we can sustain those programs. And then, of course, how to disseminate, as well as a program clearinghouse that provides specific information about programs that have been successfully implemented in these communities, and it provides rural contact information for these rural implementers. Rural people like to talk to other rural folks. So with that, let me introduce you to our Rural Transportation Toolkit. This toolkit was one of the top issues identified when we go to communities around the country and we ask, what are your top 3 issues affecting health and well-being? And no matter where we are, transportation comes up either 1, 2, or 3, depending on the community. And as we know, there are a lot of challenges in many rural communities. As was mentioned, many do not have public transportation, or they have very limited options for public transportation. There's often long travel time. For some of us, we have some challenges with weather that further exacerbate our ability to get from place to place. And a lot of our communities in rural America have yet to have rideshare, such as Uber or Lyft, penetrate their local markets. And as I said, you can go to the RHI Hub and find the toolkits under the evidence base link. And there is information provided for you. Click on any module that you would be most interested in. Well, let me introduce you to what is included in this particular toolkit. One of the things that we know that rural communities are really interested in is trying to figure out ways to improve access. And about 1/3 of our rural communities have at least some kind of fixed route bus. As I said, my frontier community of Towner, North Dakota, population 532, had or currently has a bus that comes once a month. It stops downtown at 7 a.m. and picks up people and brings them to the larger urban community of Minot, North Dakota, about 55 miles away. And it provides a number of stops so that people can access clinics and other types of healthcare providers. And then the bus returns at about 5 or 6 p.m. And that works great for some people, but for those people that are fragile or older, being on a bus for over 10 hours in a day can be very taxing and be very physically challenging. There are also a number of volunteer programs that have been well received in rural communities. Some of them are door-to-door, and what we mean by that is that they help, for example, if a person has difficulty ambulating and they need help getting from their front door to the car and then into the place where they need to go. Some of the volunteer organizations provide that additional support, but some of them do not. And there are some other considerations when looking at some of these volunteer programs. I know in some of our interviews with implementers, a consideration they noted was to make sure that we were being very mindful that some of these programs assure that the person has a valid driver's license and that they have insurance to make sure that the driver and the rider are covered by those, but also to make sure that their cars are in working order. And you may think that that is a given. However, I was evaluating a community health worker program in a rural community, and I got into the car that the community health worker was using to transport patients. And when I went to secure my seatbelt, there was no seatbelt. The person had cut the seatbelt and put the end of the seatbelt into the the base so that it would not set the alarms off in the car. But she proceeded to explain to me that her husband hated the seatbelt and they just cut the seatbelt off. So one of the things that we include in our consideration is to also make sure that the transportation is being provided, that the vehicle is also in working order, and that safety is front and center for that. There's some programs that include some vouchers. Some of the programs also include coordinated services. There are some non-emergent medical transportation paid by different programs, such as the Medicaid program, or our Veterans program also has some transportation, and looking at how perhaps some of those transportation options can be leveraged to be able to transport more than one or two people. Really trying to coordinate, and sometimes that also involves community organization or other types of social services, or even our faith-based organizations really come together to provide that support. Likewise, there's some programs out there that provide some opportunities to do some bartering for services. So somebody might need help getting to an appointment, but perhaps they can help the driver with completing their taxes or supporting them in some other ways. So there's some very unique ways that rural communities have come together. And what we often say is some of the most innovative solutions are really coming from our rural communities, because, as they say, necessity is the mother of invention. And when you have limited resources, people become very creative. I would also add that one of the top considerations that we also heard was the importance of doing background checks. Many times these rideshare programs, in terms of either a volunteer program or within the community, they're supporting vulnerable adults, be it people with disabilities or older adults. And there are people out there wanting to take advantage of them. So also thinking about the safety from that perspective is an important consideration. With regard to overcoming transportation barriers, there's a lot of different ways we can do it. And I think especially through COVID, we have seen the telehealth options explode out there. Many people are getting their services via telehealth now that were not an option 2 months ago. And so those types of services really allow people to transcend the need for transportation if they're able to get those telehealth visits at home. I would also mention that one of the issues that we still hear in rural is that we have many spots that have challenges with the broadband infrastructure. So if there's any kind of a video conferencing component that needs to be in place, sometimes the infrastructure is just not there to support that. So as we continue to look at relying more and more on different types of telehealth and patient monitoring in their homes, we're going to have to be very mindful of that as well. We also see more options for school-based and work-based clinics, so that people do not have to take time away from those educational or those work activities, and they can seek services locally. With regard to transportation safety and infrastructure, There are some really interesting issues that can be addressed in terms of improving road safety, particularly in communities that are trying to encourage more walking and biking. There's many different ways that that built environment can be enhanced to improve safety. And we also know that there are interests in providing more charging stations. For example, a lot of older adults rely on scooters, and a lot of times those scooters have limited battery capacity. We know that there are many rural communities that are looking at where they can put those battery charging stations so that people can have broader mobility and be able to access more parts of their communities. So that kind of gives you a nutshell of what is in this toolkit. There's a lot more information there, so I highly encourage you to take a look. We also have a complimentary brief on rural transportation that kind of summarizes the information that is on the website in the toolkit. And this brief is available on our Walsh Center website, and also linkable from the toolkit on the RHI Hub website. So I invite you to take a look at that. It's in PDF, so it's easy to share. And we also have a full array of other toolkits that are available that may be of interest to you. Our newest one is the Social Determinants of Health Toolkit. And I know that this group is also very interested in the energy issue. And one of the things that we learned in one of our projects in Missouri was when it comes to affordable housing, which is part of our social determinants of health, one of the issues that was raised by rural residents in Missouri was that the cost of housing was affordable, but the cost of electricity was not. And so there are some interesting issues that are raised in these different toolkits. And again, a lot of this information is also, you can cross-reference, such as philanthropy and the like. And lastly, I just want to leave you with a commercial slide, if you will, for the Rural Health Information Hub, in case you are not familiar with it. As I mentioned, it is a rural health information portal. It has an online library. It includes information about funding opportunities and a whole host of different topics. And you can either call that 1-800 number or access through email an information specialist. And if you have a question about something, or you're interested to see if there might be a funding opportunity, for example, to look at supporting rural electricity for affordable housing, as part of affordable housing, you can contact an information specialist, and they will comb through all of the resources that are out there, be it on the governmental side as well as the philanthropic side. And lastly, my contact number and email is available, and please let me know if there's anything I can do to provide any additional information for you. Thank you, and I will turn it over.
Great, thank you so much, Alana. And now I'm going to pass things over to Diane for her presentation.
Okay, can you hear me and see my slide?
Yep, all looks good.
All right, great, I'll get started. So I'm really glad to be speaking to you all today. I'm hoping that this slide will give you an idea of why I was invited to speak. The North Carolina Electric Co-ops serve 24% of the population in North Carolina, but that population is spread out over 45% of the land mass. Our cooperative territories are shaded in green, and if you're familiar at all with North Carolina, you'll see that although we do have a few co-ops located near urban areas, for the most part, we serve the rural parts of the state. We serve about 950,000 households and businesses in 93 of the 100 counties. It's also important to note that the North Carolina Co-ops are a not-for-profit member-owned organization. So whenever we're doing something, we have to be very conscious of the cost. A lot of our members are low to moderate income, our member consumers. I work for the statewide organization, which is a partial or full wholesale power supply organization and trade association for the 26 co-ops in the state. So as was mentioned, my role is very much focused on beneficial electrification. And when I first started hearing about electric transportation, what I realized was that I didn't know what I didn't know. And I have come since then to learn that it is a key component of beneficial electrification. I've also come to learn that beneficial electrification is a really important aspect of what is going on and is something that the North Carolina co-ops have decided to really focus on. That's because the rapid advances in digital technology, including smart meters and sensors, are changing the way we use the grid, as are the increasing number of distributed energy resources. So we're now very focused on integrated operation, recognizing that supply side resources and end uses of electricity, such as electric transportation at the edge of the grid, impact not only our costs, but also can impact our environmental impact and our grid flexibility. So as I mentioned, beneficial electrification is a focus point for us. And if you haven't heard of it, you can go out to this website, beneficialelectrification.com, lots of great resources out there. But what it is electrifying end-use technologies if they can do one of the 4 points shown on the slide without harming any of those. And, why is that beneficial? It's beneficial because the switch to electric technologies can lower costs for both utilities and consumers. For the co-ops, it means a more efficient utilization of the power grid, resulting in lower electricity rates due to higher grid utilization or a higher load factor, and more effective system operation. For the consumers that own us, beneficial electrification can result in reduced fuel and maintenance costs for electric vehicles and lower operating costs for advanced industrial equipment. And the switch to electricity helps the environment as well. Currently, electricity accounts for about 20% of the country's total energy mix. As this percentage grows, we'll see an overall reduction in emissions economy-wide because electricity is a cleaner form of energy than power produced by using fossil fuels on site. And we got that from an EPRI National Electrification Assessment. EPRI predicts that by 2050, emissions will go down by 70%, even as electricity grows to 45% of the total energy mix. I do want to point out that beneficial electrification does not mean electrifying everything, but doing so when it makes sense. So we had EPRI do an electrification assessment for just North Carolina, and we did this study jointly with Duke Energy in North Carolina. And what this study did was it looked at the opportunities for electrification in North Carolina as opposed to nationwide. And this slide here shows energy by fuel and end use application. The blue bars demonstrate how much of each end use application is currently being supplied by electricity versus another energy source such as natural gas or petroleum. Electricity use in North Carolina is slightly higher than it is in the nation as an energy use, but still you'll notice that the blue bars overall still only make up about 27% of the energy mix sector-wide. What you see here is that by 2050, there's a big decrease in overall energy. A lot of that is due to electrification and mainly due to electrification of light and mid-duty transportation. So EPRI study predicts that electricity use grows by 12 to 30% by 2050, even while total energy consumption declines 15 to 22%. A major contributing factor is that EVs are predicted to use about 65% less energy than an internal combustion energy vehicle by 2050. Because of that, the North Carolina Electric Co-op see electric vehicles as the single most significant beneficial electrification opportunity. That has led us to develop an EV strategy. We came up with this strategy by working with an internal group made up of one representative from each of our 26 electric distribution co-ops. and we facilitated that group. They developed this strategy which focuses on the 3 points shown here: awareness and marketing, an EV charging network, and a residential strategy. So before I get into the strategy, I just wanted to show you this map that shows the amount of EV registrations, new car registrations that are for electric vehicles. And you'll see, of course, that California and some of the other zero emission vehicle states are much, much higher than many other parts of the state. But I also want to point out that there is one area in North Carolina that is one of those lighter colored areas. We actually have Orange County, North Carolina, which has close to 5% of their new vehicles electric. So although we do have that, we also have many, many areas in North Carolina that are served by co-ops that have, between 0 and 0.5% electric vehicles. So there's very much a diverse kind of sector here that we're looking at. So we needed to come up with a strategy that would work for all different kinds of EV penetrations. So EV awareness and marketing was one of the key things that we focused on first. When you look at the rural areas that we serve, it's difficult to get an electric vehicle. Many of the car dealerships don't even offer them. A lot of people have not ever even seen an electric vehicle or really know what they are, what they do. So what we have done is we've worked with the co-ops to help them implement getting fleet cars in place. And many of the co-ops have wrapped their cars to make it obvious that they're electric. They use these cars not only for their staff to go and experience driving electric and to take to meetings and things like that, at least when they could go to meetings, but they've also used them to hold regional EV events along with other people in the community, if there are some that drive EVs. Another area that we have focused on is improving affordability. So we worked with Nissan to get an incentive in place, and that is actually available for all cooperatives in the nation now. For a while, it was just the North Carolina co-ops, but the NRCS organization helped get that Nissan Leaf incentive available to all co-op members. And then we worked with our credit union so that they offer a low interest rate loan for these as part of our Brighter Energy Future initiative. Another thing I just want to point out here is that some of our co-ops have held events where they let people check out the cars and drive them. One of the co-ops, which is located on the Outer Banks, actually lets their member owners check out the car for the weekend for 3 days at a time so that they can really experience what it's like to charge the vehicle and to experience just day-to-day life with an EV. We also implemented a cooperative microsite just to provide information, and we paired that with an advertising campaign, letting people know in certain areas of the state about this microsite where they could go to get more information. If you go to that website, you'll learn more about what each individual co-op is doing around EVs, and you'll get general information on EVs there as well. We also decided to focus on putting in an EV charging network, and I appreciated what Mark said about partnering with the electric utilities, because we're finding in North Carolina that some organizations are putting in chargers. Some of the hotels are now doing that. A few of the restaurants, of course, there's the Tesla charging network. We're not seeing a whole lot of chargers getting put in. If it wasn't for the co-ops, a lot of these rural areas would not have any place to charge. So, why did we do it? Because I would tell you that it is not a money-making proposition. And I think what's been interesting is we have looked to cite the chargers that we decided to invest in. Sometimes the reaction we'll get is, oh, you're going to give me a share of the revenue that you're going to make off of this? It's like, yeah, we can give you that $30. Sure. It's not something that you do because you're trying to make a profit from it. So I think that has been one of our big challenges. But we look at it as being very important because it encourages tourism and economic development. I think someone has to mute their phone or their I'm hearing some background noise. So what we're finding is that by putting in these chargers in some of the areas where we have put them in, we can now have people come from Atlanta, we can have people come from Washington, D.C. to go to the parts of the state that we serve, like the beaches and the mountains. And I'll show you in just a minute the map of where we put those chargers in. The other thing is that our co-ops were very interested in understanding how these chargers were going to impact their infrastructure. And they're using the data from these chargers to look at the charging patterns and the different rate and billing structures, and how those impact when and where people are charging. This is our EV rural charging network, and what you see are the red markers, which are the DC fast chargers, and then the blue are level 2 charging stations. When we started out planning this network, we already had a few chargers in place that some of our co-ops had invested in independently. We had many other co-ops that, as I said, didn't know what they didn't know, hadn't really focused on this. And so we kind of came up with a goal to try to get at least one charger in each one of our co-ops areas. You can see here we've done a pretty good job at that. We still have a few holes to fill. We've found the funding to be challenging as well. As I mentioned, some of these chargers are not getting used a whole lot. We had planned to use Volkswagen funds to help pay for some of these chargers, but the process in North Carolina has been very delayed. And although there was close to $5 million in phase 1 that was supposed to go to zero emission vehicle charging infrastructure and school buses and things like that, that was supposed to be released in Q2 of 2019. We still haven't seen the results of the RFP that was held. We put in 17 charger sites, and I will tell you, for quite a while, we just held on and didn't do anything because we really wanted to, as much as possible, not spend our members' money. If there was money available for chargers, we wanted to use it. And it took so long for those funds to move that we finally decided to invest $1 million. So that $1 million resulted in 10 of the DC fast chargers that you see on this map and 11 of the level 2. The rest were funded by the individual cooperatives. We're still hoping that we're going to see those VW funds get released soon and potentially fill in a few more of those holes. The VW money was really focused more on the networks, the road systems where there's high traffic, and that was something that put us at a disadvantage of getting that money because, as I mentioned, many of the areas we serve are in the rural parts of the state and aren't necessarily on those highway systems. And then finally, we're very focused on residential chargers. We know that most people who own an EV charge at home. I own an EV, and it's been, my whole viewpoint on electric transportation has changed dramatically since owning that. I know it's really important to have those fast chargers where you need them, and to know that there are multiple chargers. You wouldn't want to know that you had one gas station with one pump. If you were taking a long trip, you would want to be sure that there were multiple stations in case it got really crowded or something broke down. So originally my one charger in each co-op, I now know that's not enough to give people comfort. So we have a long ways to go with infrastructure. But for the most part, people do charge at home. So we have put together an EV toolkit that our co-ops can use to help people understand how to charge. They can hand out information from that toolkit. Our co-ops have individually decided what to do when it comes to rebates and incentives, and in some cases, time of use rates or other rates that help incentivize people to charge at the right times and can also save them money. And then we're working with some home builders as well to get them to go ahead and pre-wire homes for level 2 chargers, so that is not an additional investment that needs to be made later on. And again, it's just an education process. It doesn't cost much money at all for builders to go ahead and pre-wire those homes. So that's an area we've been focused on. So that's it. That's a summary of our strategy. We know it's going to continue to evolve as the market for electric vehicles mature. So for now, we're really doing our part to ensure that the co-ops are not only ready for, but are also promoting a future with increased electrification of vehicles. And that's all I have. Look forward to questions. Thank you.
Great, thanks so much, Diane. So I don't see any questions that have come in yet. Mark, if you want to kick it off again. Sure, and if other people do have questions, again, there's a questions feature in GoToWebinar where you can type it in, or there's a hand raising feature. You can indicate you have a question, and then I'll unmute you and you can ask it. So Mark, let's start with you.
Diane, I have lots of questions, sorry. So first off, Diane, in your presentation, you had the EPRI heat map of EV registrations. Is that public or is that like a paid subscription? How did you get that? That is cool. I want that.
Yeah, isn't that cool? So, you know, we got that through our membership with EPRI, and they have access to the DOT new registrations. I think you're welcome to use that slide now that it's out there. But the detailed data, I think you have to be a subscriber to a certain database of data. They've given us a lot of really good information through our membership.
Yeah, because I know as a state agency, we try and work with our DMV and get data, and I know a lot of other states are trying to work with their DMVs, and it's all over the board. On some DMVs aren't even tracking it, and then to see that had all the counties and all the states, I was like, ooh, I bet you there's some data quality issues, but yeah, that was really cool to see how that was pictured like that. Question number 2 for you. When it comes to the tariff structure, the rate structure for all the co-ops when it comes to EV charging, what are you seeing the co-ops doing? Is there some sort of pattern? Are they adopting tariffs specific for EV charging? Are they waiving, like specifically when it comes to demand charges? This has kind of been an area of focus out here in the West, a lot of discussions. I'm kind of curious to your experience. What have you been seeing?
Yeah, that's a really good question. And it is something that we are, you know, we're really focused on just bringing as much information to our co-ops as we can and helping them understand what they need to take into account when planning for the future. So right now, they own most of these DC fast chargers. I think when we're going to start to run into problems is when we start to see things like fleets getting electrified that might all be charging at the same time at the time of the peak demand, or trucks that are being charged, you know, those high demand chargers. So right now, most of the chargers that we have on our system are not causing big increases in demand charges. So we have educated our co-ops on, you know, how important electrification is, and that we need to think about the rate structure so that they don't disincentivize electrification because of increases in demand charges. So that's just something that we have been talking to them about. For the most part now, they have their own structures that they are using, different tariffs. So some of them, it's kind of all over the board. Some of them charge, when it comes to the DC fast charger, some of them charge just, you know, for the time, or they might have a per kWh charge. And then the same thing for home charging. A lot of them have different rate structures that they're using. So it really varies.
Got it. Yeah. And so what I mentioned kind of early on as a key to success in Nevada, we found is engaging the co-ops and the utilities to have the discussions with the host sites. Because if the host site's going to own it, then I want the utility there to talk about what the anticipated impacts of the infrastructure are going to be on their bills. Because if they're, you know, everybody has different tariffs. If they're a small tariff and they, by installing this, it might kick them over to the next tariff up, it could be detrimental to their business by making their bills go through the roof. And there's some things we can do in designing these projects to make sure we spec out the equipment, that maybe put some fail safes in place so that doesn't happen. And in Nevada, we've seen some co-ops go to their board and get exemption for us project by project to basically waive demand charges. We've seen some pass specific tariffs saying, hey, for this thing, it's going to have an EV only tariff. So that means we're going to separately meter the EV infrastructure from the building, so that way it doesn't, you know, we see stuff all over the board. And the investor-owned utility in Nevada, they, what I call a demand charge holiday, which another couple of the Berkshire Hathaway companies are doing. It's basically for EV charging, if they're separately metered, they get a 100% reduction in demand charges on year 1. Year 2, it goes down to 90, then 80, then 70. And so it's a tiered approach. It's kicking the can down the road, but it helps provide some confidence to folks that have maybe heard some of the horror stories that, you know, somebody comes up and spends $10 to fill up their car, and all of a sudden on the back end, that host site's paying $200 in demand charges. And that's what we want to avoid, if at all possible.
Yeah, those are great points. And do you have that information out somewhere where it's accessible so we can go out and take a look at what has happened in Nevada?
Oh, the investor-owned utility, that's a public record. I'm happy to share that. The co-op,
Okay.
so we can work with our co-op association to see what they've done. It's just through implementing the project. This is kind of what, it's not officially part of the project. This is stuff I'm keeping tabs of, and I'm just kind of relaying the story. So I can work with them and see if we can get some information out.
Yeah, and I can find the Nevada co-ops too through my contacts. But that's really interesting. Thanks for sharing that.
And then Alana, a couple questions for you real quick while we get this flood of questions coming in from everybody else. So you obviously, you're not an energy person, and a lot of us are energy nerds out here. And so I'm wondering, when it comes to your work in kind of rural transportation and rural transportation, the projects out there, have you seen any preference, or is there any kind of documentation that maybe, or studies that show that electrification as a choice of transportation options for the rural folks has any benefits? I mean, I know anecdotally we've been hearing about asthma and whatnot, but I think that's more kind of for an urban setting. So I'm looking more for a rural setting. Have you seen any projects that are using electrification as a transport option or project, and was it successful? And you're muted, and I don't know if we've lost you.
You just unmuted, Alana, so you should be on.
Great, thank you. You know, I can't speak to any specific ones, but I have to say one of the things that I heard at a recent conference was the concept of electric unperson driving, you know, vehicles, and you know the opportunity for rural not having to rely on a workforce to drive. And so, you know, when you look at self-driving cars in the future, and a lot of those are electric, there's some real expectation that that might help address some of these unmet transportation needs.
Awesome. Yeah, autonomous driving. Yeah, it's a whole interesting concept, and the amount of infrastructure that's required again to do that. Yeah, that's interesting future there. When it comes to you have the great toolkit. Is there any funding that it comes with this toolkit, or that you're aware of, or that you can make available to people, some funding opportunities? Because right now you've outlined what seems to be a great process that people can basically pick up these toolkits and implement projects. And so the next hurdle I'm envisioning in my mind is funding. So is there a regular funding source? Is there any kind of funding opportunities for folks that are interested in that you can make us aware of?
Yes, the Federal Office of Rural Health Policy has regular funding opportunities for community-based programs. And if you go on the Rural Health Information Hub under their funding, they routinely share those. And these types of funding opportunities require a network, so that you are looking at usually at 3 entities. And because these dollars are under a congressional set aside for this program, there has to be a connection between whatever is implemented and improving health and well-being and improving access to healthcare. And so one of the things that we have seen is that there are alternative payment models that have been implemented in a number of communities. And some of you may have heard of accountable care organizations, where the focus is really on the value of the care that's provided and not reimbursing solely on volume. And a number of those programs have actually moved some of their funding to transportation to be able to ensure that people are able to get to their appointments. They don't have missed appointments. And particularly when people are discharged from the hospital, to make sure that they get in a timely manner back to see their primary care doc so that they don't end up back in the ED or rehospitalized. So looking at how to leverage those health dollars better in the transportation arena is one way to be able to expand access to transportation programs.
Awesome, thank you.
Thank you, Alana. That's really helpful. And I have one question for each of you that has come in from the audience, so hopefully we can get to both. Diane, we had a question asking if any of the charging stations have used either solar or like a battery backup, any type of alternative powering sources like that.
We have a few that have something like that. I mentioned earlier that we have really focused on tourist areas. And so we have some level 2 chargers that are at the North Carolina Zoo in Randolph County, and those are hooked up to solar, and solar is used to charge those. I think one of our co-ops has solar with their DC fast charger as well. For the most part, we have partnered with ChargePoint, and they have really been a good partner to help us in getting these this first round of chargers sited. So I will admit it wasn't a focus for this first phase, but I think it's something we would consider looking at more in the future.
Great, thanks, Diane. And then we have one more question for Alana, and I'll unmute Katie right now to ask that. So Katie, you should be able to talk.
Can you hear me?
Yep.
Perfect. Alana, I just had a question about new programming for rural communities. About how long would you estimate a new program would take to take hold in a community? And is it really more to do with the amount of effort involved in trying to get that program out there?
Well, you probably hear this many times, but a lot of it has to deal with the leadership. And, you know, the success of implementing a program really depends on the champion or champions that carry that program forward. And when you get that kind of energy behind a program, you know, that's one thing we often talk about in rural. Things can change on a dime in rural, whereas if you're trying to implement something often in a larger urban community, for example, or an urban organization like a large health system, it takes a much longer time. So when you have programs that are implemented at a rural community, the one thing I would suggest is to make sure that you do that analysis or assessment up front, so you know that your program is targeting an unmet need or improving upon what is currently available, because that will certainly jumpstart your ability to gain traction.
Great, thank you, Alana. Well, I don't see any other questions, but I just want to take a minute to thank all of our presenters for all this excellent information and providing it to NASEO. There will be, NASEO will be posting a recording of this to our events website, so you can access that for versions of both presentations that were given today, and also once it becomes available, a recording if you want to listen again. So thanks so much everybody for calling in, and thanks again to the presenters for all your hard work preparing it and your work helping with rural transportation. So thanks everybody, and everybody have a great one. Bye.
Bye-bye.
Bye-bye.